Back tonight, here on In Focus. Let's go back to that leading story tonight. The Gauteng Health Department has confirmed an investigation into a claim that patients are being mistreated at the Johannesburg's Helen Joseph Hospital. It follows a viral video of a patient complaining that staff, including doctors, allow those being treated to suffer. Now, for more on these allegations, let's speak now to the Gauteng Health Department spokesperson, Motalatale Modiba. Motalatale, good to have you, and thank you very much for your time this evening. We've noted, of course, that the MEC has been appraised about the development, especially in the care of Mr. Tom London, and you are confining your response to say you are satisfied that all the clinical requirements were met. What do you mean by that?
Look, thank you for having us. I think it's important that we have that distinction, given that in the complaint that he raised, there were quite a number of issues. And I think the first one, the primary one, is the issue around the clinical care as to whether the right protocols were followed, as to whether the treatment could have been any different. And the report that has been produced by the clinicians and the facility indicates that all the necessary steps were taken. Remember that the patient was in our hospital for 2 weeks prior to the complaint that he would have raised. So the time when he arrived at the hospital, the condition that he was at, and the condition that he was at when he decided to discharge himself are two different conditions. And I think the team there was able to stabilize him and give him the necessary care. And hence, from the report that we have received, we have said as a department that the department is comfortable with that clinical report being subjected to an independent review to look at the type of clinical treatment that he was given. And we're quite confident that the necessary protocols were followed and everything that could have been done to try and give him better care was done. I think the issue where perhaps there's a question mark is the issue around the infrastructure issue that he might have raised as part of his complaint. So obviously that is something that we have considered, that indeed we do acknowledge that to a certain degree there's part of our infrastructure that obviously would need to be looked into, and it's things that we have already pronounced on in terms of indicating that we do acknowledge that a lot of our facilities, their infrastructure is old, and therefore the department has put in place a maintenance and refurbishment program in place.
Yeah, bearing in mind, of course, that over and above the requirement to the health facility giving clinical care, there's also an obligation on the state to comply with the Constitution, Section 2, Section 7, rather, Subsection 2 of the Constitution, around the rights that are enshrined in the bill, protection and promoting of those rights and the dignity of the client. I think a major part of the gripe here is not whether or not Mr. London did receive a degree of care, but he's disgruntled and describes a shocking way in which that treatment would have been given to him without maybe even the degree of care and empathy and professionalism that he would have expected.
That is something that I think we have already also indicated that we're looking into, and in fact a team has already been dispatched at the facility to actually look into that particular part. We do admit that the department, the reason why we have launched the I Serve with a Smile campaign was precisely because of the feedback that we have been receiving from patients over a period of time through the patient of experience of care surveys that are done regularly at facilities. And that feedback said to us, we need to work on staff attitude, we need to work on issues of batubili, of redress, and of ensuring that the way in which it's not just about rendering the care, as you have said, it's also about the way in which we go about rendering that care, but also improving the communication between the clinical staff and the patients. Because sometimes you might be best at what you do in terms of the clinical care that you're giving, but It's the softer issues of how we engage with patients when they are at our facilities, as to whether we help them to also understand the type of treatment that we're giving them and why we're doing certain things and so forth. So I have to agree with you there that indeed it's something that we have to work around, and I think we've already committed in terms of that. A team has already been assigned to actually assist the facility, because they are on a path as well to launch the I Serve with a Smile campaign within that particular facility. So we will indeed be zooming into those issues that relates to how the care is given and how we continue to have better engagements with the patients, including being able to create avenues that allow the patients to have the comfort that where they are not satisfied with anything, they are able to approach us and to raise those issues with the confidence that their issues will be properly resolved.
Tata, I was saying one of the complaints was the body of a deceased that was left lying in bed for 20 minutes without being taken to the morgue. We put that question to Dinosa. They said, well, as far as the nurses are concerned, they had done their bit. They were waiting, it would seem, for porters to do their bit in terms of taking the body to the morgue. Now, there seems to have been a failure in the system of the deliberately planned regime of services and interventions as far as that is concerned.
There was no failure in the system. And I think it's rather unfortunate that Tom decided to actually publish a body of a deceased in the facility, putting further distress on behalf of, on the family of the particular patient. And it's in violation of the rights of that family and of the rights of the patient there. We understand that he had his own issues and he was probably displeased about something else. But your displeasure does not necessarily mean that then you need to violate the right of other people when you are at a hospital. And I think in this instance, it's a classic example of sometimes the unfortunate consequences of social media, that even when due processes are done, remember there are processes even within a facility when someone demises, you're talking about 20 minutes, and it's still within time in terms of the process needs to be taken to manage that particular issue. Unfortunately, the aggrieved patient decided to film himself and film other patients, and therefore ended up unduly publishing them even while other processes were still unfolding. We cannot rush simply because someone has an urge to put things on social media. He could have still raised his own complaint without necessarily putting the other patient, and because the family of that patient, apparently they learned of the demise of their loved one when they saw it on social media. That on its own does not, you see, one right, two wrongs don't make a right. And we cannot allow a situation where simply because Tom London raised an issue, therefore we allow his other actions to also go unnoticed. It's something that we have to discourage, that when you are aggrieved and you are lodging a complaint, be mindful of the rights of other people, because when someone demises, there's a process within a facility within which that process must be followed in order to manage the body accordingly and to also notify the family. For them to learn through social media because someone decided to film that and put it out there, it's rather unfortunate.
So you are saying, sorry, Motalatale, let me come in there. You're saying that process was still unfolding, in other words, because the nurse says it's around 6, there was a shift change, and so on and so forth.
So that process, yes, was unfolding. Had with the benefit of time, because it's not that it's the first time that someone demises at a facility. There's always that process that it gets to be followed, including bringing in the morgue in and the necessary documentation that needs to be properly filled and so forth to manage that process, that the remains or the body can be properly taken to where it needs to go within the facility. So it was wrong of London to even put that on social media just to emphasize his own point. He could have even mentioned it without necessarily violating the dignity of the family of the loved one. But of course, it does not take away the issues that he is raising. Yeah. And I think we need to be clear around that. So that we're not saying because of that, then we're automatically dismissing the issues he's raising. We're saying there is merit to looking into the issues that is raising. That's why we're giving them the necessary attention. But we must not mislead the public to thinking that two wrongs make a right. In this instance and on this one, I think he owes the family an apology because they should not have learned of the passing of their loved one in that manner. And I think the unfortunate thing about social media is that often things are exaggerated. And by the time we come to explain the process, the damage has already been done.
Now, you obviously speak for a political principle, so some have turned this into a political matter, and by some I mean the Democratic Alliance, and they have, of course, weighed in on this. Jack Bloom saying the following: "It is appalling that Helen Joseph Hospital has not had a permanent CEO for years and promised upgrading, which has not happened. The department's I Serve With a Smile campaign has clearly failed at this hospital."
I think you've said it quite well. There's a lot of politicking that is involved in this particular instance. One, the I Serve With a Smile program was launched when? In November. It's still at its infancy. It's been rolled out, and many people who utilize our facilities can testify to the fact that they are starting to see change taking place insofar as the staff attitude is concerned. Change management obviously does not happen overnight. It's a process that we must continue working on. But secondly, the issue around the infrastructure, I think sometimes it's important for public representatives to actually be truthful in what they say around some of these things. You would recall that in May, just May this year, 22nd of May, the MEC was at the very same facility opening a newly refurbished ICU unit, emergency department unit, which has been refurbished, which has been enlarged, responding in particular to some of the issues that were raised by the public in terms of the space in that particular facility, in terms of the need to refurbish. So because of we obviously have a limited budget, when we do this maintenance and refurbishment, we do it incrementally, moving from area to area. And I think we did indicate several facilities where we've already done renovations and refurbishment of various units. So we do acknowledge that the infrastructure does need, because we're talking about old facilities, it does need us to pay attention to it. But we should not mislead the public at the same time and say there's nothing that is happening there. Those that are utilizing that facility, they know that they now have a relatively new accident department that has been refurbished, expanded, and it has improved care. The particular area that we're talking about, which the patient was at, we were at that particular ward today. And actually, the situation is not even as dire as the way he paints it in terms of it's not dilapidated. It's just, yes, it needs the bathrooms and the taps there, yes, need attention, but actually it's not, it's an environment where I would myself comfortably be able to make use of that infrastructure as it currently stands. So we've already considered that. I think in terms of infrastructure, we have a program. We are working on ensuring that we incrementally improve the infrastructure and we maintain across our facilities. Yeah. But the public should not be misled into thinking that actually nothing is happening. The accident department is quite new. We have refurbished it and it's there. I mean, you can go tomorrow to that particular department and you will see what we're talking about.
Finally, as I let you go, then two appointments that are problematic. One is one that has not happened, that of the CEO, but two, they are also slamming the appointment of the provincial department head, saying he's compromised under an SIU investigation.
One, the issue of the CEO. There's a process that is currently underway. In fact, it's at an advanced stage of recruitment. If I'm not mistaken, I think in the following week, interviews will be taking place insofar as that particular role is concerned. So that process is far advanced. Secondly, the issue around the appointment of the HOD, and we have been saying this several times. The appointment of HOD is the competency of, is done by the Office of the Premier, which has a responsibility in terms of the recruitment of HODs. But there's nothing untoward insofar as the appointment of the head of department for health is concerned. Secondly, the SIU has already spoken previously to say in fact, the head of the SIU was asked at some forums, and he did respond to say he was not briefed of any investigation that relates to the head of department. And I think it's rather unfortunate that the GS decided to play politics when it comes to this, that to mislead the public when it comes to this particular matter. If there's an investigation, the right bodies that are competent to do so will announce and will indicate, and they've not done so. So where we are, the matter is being handled at the right levels, and I think we should not embark on a smear campaign simply because we were disgruntled or we want to discredit those that are working hard day and night to service the public.
Motalatale, I appreciate your time. Thank you very much for indulging us this evening. Motalatale Modiba speaks on behalf of the MEC for the Department of Health in Gauteng.